My name is Bo. I'm a nurse here in the emergency room at the Jackson Purchase Medical Center, and I want to talk to you about early heart attack care. So early heart attack facts. Heart attacks are the number one killer in the United States. Killed more people than COVID did last year. 805,000 heart attacks occurred. 805,000 heart attack deaths occurred last year. 605,000 were those first heart attack of the person. And then the other 200,000 are people who have already had a heart attack that has second or third heart attack. In the United States, one heart attack occurs every 40 seconds, and 1 in 5 heart attacks are silent, meaning they have no symptoms or the person's not aware that they had a heart attack, but yet damage was done to their heart. So some of the heart attack signs and symptoms is chest fullness or discomfort or pressure, chest burning or aching, and it can happen on either side of the chest, right in the middle of the chest, dizziness, shortness of breath, weakness and fatigue, sweating and nausea, jaw pain or arm pain. And commonly people think of the left arm pain. Now that does occur more often, but it can be the right arm also. So some of the risk factors for heart attacks are family history of cardiovascular disease. So just because you don't have a history of anything with your heart, if your family, your father or your mother, uncles, brothers, sisters do, then it could be a problem for you also. High blood pressure or being overweight or obese, a sedentary lifestyle where you're just not very active, including office jobs or even jobs such as mine as a nurse, using tobacco products, and that's not just smoking, smokeless tobacco or vaping also. And then for women, just because you use birth control pills or you've had pregnancy preeclampsia, gestational diabetes or low birth weight can also be some risk factors for a heart attack. So why do people die from a heart attack? So the heart's a pump, but it requires a lot of blood flow to feed it, to give it the oxygen and nutrition that it needs to do this job. And when those vessels get occluded, either blocked by cholesterols or the vessels constrict from nicotine, then that can prevent the heart from getting the blood that it needs, and then that's when you have a heart attack. When the blockage occurs, it interferes with the blood supply, and then the interference can cause damage or cell death to the heart and can cause the heart to stop working. Some symptoms commonly in men is pain to the left side of the chest and to the left arm. Now remember, this is common symptoms for men. It doesn't always have to be that, but the typical presentation for a man having a heart attack is left sided chest pain and left arm pain. Some symptoms in women is pain and numbness to the right arm. Women often present different than men do. They don't have the same crushing chest pain, they don't have the left arm pain, but they may have numbness in the right arm, or they may just feel very tired, fatigued, upper back pain that travels into the jaws or the neck, and then stomach pain or burning pain in the epigastric area right here. People think that maybe an ulcer or just heartburn could be a heart attack. Women don't have heart attacks as frequently as men do, but they do die more often than men do because they don't get it diagnosed. They dismiss it and think it's something else because it's their stomach hurting or it's their jaw hurting. They don't have the same symptoms that we normally assume as a heart attack. Some atypical presentations of both men and women, and you see this more often in your older patients, or you see patients with other health problems such as diabetes, is they may have lower abdominal pain, they have a pain that spreads in their jaws, or they just feel really short of breath, a really labored breathing where they just can't seem to get enough air. Heart attacks always have beginnings though, so it's important when you have the symptoms to be seen about and have it checked out with quickly, because the sooner you can correct the problem, the more heart tissue or muscle that you can save. And then to prevent heart attacks is you need to see a physician right away. You need to see a doctor right away so they can do the test to find out if it is a heart attack. Or taking aspirin, 324 milligrams of aspirin before you go to the doctor can help open up those arteries and break up those clots. If you can detect it early in the beginning, you can actually save a life. And then direct the person to an accredited chest pain center such as any hospital in our area, and they can do the appropriate test to find out. Some of the signs and symptoms that are easily ignored by the victims of heart attacks or by people that are with the victims of heart attacks is they deny that it's a heart attack because the symptoms are mild. I have seen people before, people that I've worked with have had heart attacks while we're working, but they dismiss it and say, no, it's just something I ate, or it's just I'm tired, but it could actually be a heart attack. And then the onset of the pain might not be noticeable, or you might just dismiss it as something else. A strong tendency to continue business as usual. You just want to continue doing your thing, or finish up your work day, or finish up whatever task you are doing already. And then some people have no risk factors. They've never had any heart problems before. They don't smoke. They're not overweight. But again, with a family history, then that could lead to problems. Or you may be the first that's been diagnosed with anything. Person may seldom feel ill, and they may feel like they're indestructible, and then that makes them deny any sort of health problem that they have. And then people always want to be in control of their own thing. They don't want to have a doctor checking them out. They don't want to go through all the right tests. And then the person's just worried what others might think. They have too much pride to go and seek the medical attention that they may need. So what can you do? You can know the signs and symptoms. And typically, it's anything from your nose to your navel. Any pain there could potentially be a heart attack. So if you have any kind of pain there or shortness of breath, and those things need to be considered as possibly a heart attack. And that's what we do here in the emergency room, and that's what you should do on the street also. Be suspicious of a heart attack always. Don't let someone deny, or don't deny yourself that it is a heart attack. And then if you had those symptoms, or if you're with someone that has those symptoms, call 911, call EMS. And EMS, they have everything that they need to diagnose and look for and potentially treat a heart attack if that's what it is. And then also as the public, we can learn CPR or hands-only CPR, and learn how to do chest compressions. If someone is having a heart attack and they need that sort of intervention, then you can make a difference between living and dying if you know those things. And learn how to use an AED. Most churches, malls, grocery stores have AEDs all around the facility, and they're very simple to use. You take a basic life-saving class and learn how to use an AED. And then if you're at work, take the person in the emergency department immediately. Don't delay. We say here that time is muscle. Every minute you're losing some of your muscles in your heart, some of the fibers in your heart that help it contract. And the more that you lose, the more likely you are to die. Thanks for listening to me, and I want you to just be aware of the early heart attack care. Thank you.